I think things begin, when you're having struggles or you're having fertility, everything is sort of like focused on, your vagina and your uterus and your ovaries. It's like, we got to have the sperm in there to make a baby, or we need to do IVF, and they're poking and prodding and doing all these things, and it doesn't feel very sexy. So what can bring that back is to, again, touch. Intimacy isn't all about sex. It's about kind of like connection and conversation and communication, which seems to be answering a lot of these questions. So I think in kind of getting back to like enjoying touch, and that's a good way to make it less clinical. Yes, that's my answer for number one. Yes, I see many people after baby loss, and it's very hard. Loss of any kind is very difficult. And there is a grieving period, where couples grieve, and, it's hard to get back on the saddle and be intimate, again, when there's a lot of grief and sadness. And so I counsel people on really kind of taking their time, and connecting, and perhaps doing ceremony over loss, maybe like, creating something together, reading a poem, planting a tree. If you live near water, releasing something into the water of nature. I think ceremony is really important for closure, but baby loss in all stages is very difficult. And we have to be tender with our hearts, right? It's hard to feel like, woohoo, when we're grieving, right? So tenderness and compassion.
There's obviously a huge amount out there on the medical side of fertility treatment and IVF. But then when it comes to managing a relationship, there isn't so much out there in terms of you're not guided through it. So you have your hand held during fertility treatment in terms of you need to come in tomorrow and do this blood work and then go home and then ring up. But there's sort of no one else there unless you're seeking professional counselling support with you, for example, where you can sort of guide people through the emotions that come with that, as well as the physical side of it.
Yeah, like you're supposed to, okay, the doctor just says, and I see it so much, the doctor says, okay, now you're going to have sex, you did an insemination, so go have sex tomorrow. And it's like, just even sometimes giving a sperm sample is difficult, and it's like nobody talks about, like, I remember talking to a man when he was in the room, his partner was doing an IVF, they were doing it, and I was in the room with him, and he talked for an hour, and she had earplugs, she couldn't even hear, about how difficult it was for him to give the semen sample, and how they gave him this sort of video, but then he doesn't really watch videos, he wanted a magazine, and it's just like nobody taught, he just talked my ear off about it, because I think he didn't get to talk to anyone about it. That people do have struggles. It's not so easy for everyone to just go home and have sex on, like, okay, now go home and have intercourse. Like, okay, pressure on. We don't talk about males who can't get an erection because they're feeling pressured to perform. And it happens a lot more than we give credit to. And I feel like I have couples, when I work with couples together, I have them agree ahead of time on like what they want to do, like how they want to approach it. Some men don't want to know when their partner's ovulating. They just don't want to know. Which, that's difficult, because if you're only having sex during the ovulation window, then you're feeling anxious. Like, is it going to happen? But I think the antidote to that is actually regular connection, not just during the ovulation window. So that there's regular intercourse, there's regular emotional, heart-opening connection. So you kind of hit that window. Some men really do want to know, and some men want to know, but they don't want their wives to like text them like, I'm ovulating tonight. So I will say, like, sometimes put a calendar up. Some men like to just see, like, keep track of their partner's cycle. If there's just like a calendar in the closet, I've had patients do. So it's really important to actually have this discussion with your partner of like how you want to approach it. Do they want to know? Do they want to not know? And then it's just like you're connecting more often. And how do we do that when it's like both parties, which happens a lot in my practice, are exhausted? Like the man's working this really heavy and the woman's working, and then like they have like 6 a.m. They have to do it. Like I had a couple that like 5 a.m. was their only time during the ovulation window, and they both like rolled over and were exhausted. But, and can we laugh about this? Can we laugh about just, the whole timing of it all? So I think just discussing with your partner how you want to approach it is ahead of time is really a good solution. and to be honest about it. I worked with a woman yesterday who was 34, who was premature ovarian failure or insufficiency. And so her FSH, if you know anything about follicle stimulating hormone, was like up to 74, like way too premature to be losing her fertility. And they've been trying for a few years. And I just looked at her, I was like, no sex drive, right? She was like, yeah, no. Like they're just like kind of avoid each other because they've been like trying for so long that sex has become really a chore. And she's only 34. And so it was like, we talked about, and yesterday we talked about this idea of kind of becoming juicy again, that we get, so it's sort of like everyone avoids the topic because it's really become difficult. Like, I think he doesn't initiate and she doesn't initiate and he doesn't initiate with her because it's like it all is equated. She said it's all equated with loss. So she feels really bad in her body that she can't conceive, and also that it's like a letdown every month that she didn't conceive when it goes on and on and on, right? Totally happens to most people, a lot of people. So it's kind of like getting your connection back that, it's kind of, it's really hard to do, right? Because when sex becomes equated with loss, nobody wants to have it. If it's not fun and wonderful and pleasurable, it becomes like a chore. It's like mechanical, and we got to do it now. So the idea is to get back to like our juiciness, our feeling good and going on vacation if you can, changing the room. It's getting back into like basic connections of our own sensuality. And I talk about this in my book and in my course, using our senses, smell, taste, touch, hearing, right? Sight, dressing up, wearing, just getting back into your sensual self, which kind of begins with the self, right? Like it's not about, we have to feel good in our own bodies, which oftentimes if you've been trying for a while, you don't, So it's like using good aromatherapy lotions, smelling, like I have some yummy lotion on organic right now. It's like, ooh, it smells good. It makes me happy. Simple things like that. Getting back into your sensuality and for yourself, and then being able to like working at home, being with each other in pajamas to like, feeling good. But I do think it's so important to self-care. We need so much self-care right now. We need so much like more meditation, more visualization, more self-care so that we can show up and be present. Yeah. So I think it's totally true.
And don't you think that people may feel like they're the only ones feeling like that, but there must be so many people around the world who resonate with that feeling?
Yes. I mean, I remember when the pandemic started and I was like, there's going to be more babies being born because everybody's like, having, getting it on and doing stuff. And I thought, no, not really. Not in the beginning. Everybody's in like panic zone and stressed. And that's not, your parasympathetic nervous system, which is your rest and digest, is what kind of gets activated when we're feeling in the mood. The sympathetic fight or flight response is not like, you're not going to make a baby when you don't know if you're going to have to flee your house, right? So it's like getting our bodies to kind of come down and feel safe. Safety is much more conducive to making a baby than panic. We don't know what's happening in all regards. So the pandemic has heightened, I think, the fight or flight freeze response. And so it's getting people to like do things to get back into parasympathetic rest and digest mode. Mm-hmm. Yeah. And everyone, I do, like I have to really do extra care for this pandemic, extra, more yoga, more meditation, right? So I can stay okay. Yeah. It's normal. Yeah. I think that's where sometimes where we have to turn it to other people who really get us, that, we're going through stuff, and that all those kind of connections are very, very positive. And so, talking about it for women, I think is really important. When we talk about things that feels like shameful or whatever, it's not. So many women and men go through difficulty around fertility, really. And,
but to that point as well, whilst people may feel they can talk to whatever extent, if they can, to family, friends, you rarely talk about the sex side, do you?
No, in fact, I was mentioning this case I had yesterday. I tell all my patients, like, that is a subject I'm really comfortable in. So ask me any questions, because we don't talk about it at all. like it's left out of the equation. I feel like we need to talk about it. You know, it's like there's so much shame around sexuality. I mean, so much shame, you know, just like even the word like masturbation or vulva, just saying these words, penis, people like are like, it's uncomfortable and I use them a lot, you know, just to make it like, these are the names of our sacred pleasure zones. It's such a beautiful thing. We just have so much shame around it. Our whole culture does, you know, and it's hard to talk to people about it, but I think it's important, because how do we know like that we're normal, or whatever normal means? And by the way, there is no normal. It's a spectrum. You know, sexuality is a whole spectrum. It's like, you know, people don't, talk about what they want sexually. People don't even know what they want sexually or what gives them pleasure. It's just such a verboten topic, but I think it's important we start talking about it.
Back to sex. What about initiating and encouraging casual or spontaneous sex, rather than working around an ovulation timing or, you know, between cycles or whatever it might be?
This is the greatest question, because this is a question that doesn't even have to do with, it's fertility based, but it's like in general.
Yeah.
You know what I mean? Does anyone, like, it's such an interesting thing, like how do we instigate? And one of the things is casual or spontaneous sex. I noticed that that's a big thing for people. Forget fertility, because if we start instigating, or our partner starts instigating and we reject, which happens, like women are like, I'm too tired, no. Then partners don't instigate, because nobody wants to be rejected. It's a big thing. It is a big thing. And it's kind of again, back to agreements that you make with your partner. You know, I sort of made an agreement with my partner, my late husband, actually, that like, I just never rejected like casual sex. I just made it like, even if I didn't feel like it doesn't mean like, I kind of, okay, that's maybe not true when after I had a baby, where I was like, oh my gosh, I just want to sleep. I'm so tired. But, you know, given that I could do something, I tried to like make it encourage. If he instigated, I tried to reciprocate, and vice versa, because rejection is really hard after a while. So it's kind of the agreements, like it might be your agreement that if you instigate it, and you would say to your partner, like, I love you and I'm just so tired, but like tomorrow morning might be great. I mean, it's kind of like a hard thing to do, but I think that making agreements on how you want to encourage and how we want to instigate. So like my late husband would ask me like, hey, you want to have sex tonight? And I was like, oh my gosh, don't even ask me. Like, this was not how I got aroused. So for women, arousal is like 20 to 45 minutes.
And did you have a discount code for people who want to come on the course?
It's patient, PATIENT. But if you're having any difficulties, shoot me an email and I'll connect with you personally.
Wonderful. Thank you, Denise. Lovely to see you. And thanks everyone for joining. Okay.
Yeah, thank you for everyone. Keep at it.